Good afternoon. Welcome to the City of Toronto's COVID-19 media briefing for Wednesday, May 13th, 2020. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mr. Mayor.
Brad, thank you. Today, the Toronto Transit Commission is meeting for the first time online. It's another sign that we're continuing to get things done, sometimes in new ways here at City Hall, and our agencies and boards and commissions are working with us here at the City Hall itself, despite restrictions put in place to protect public health and to save lives. And we'll be working to make sure that the gains we've made on modernizing the City Hall and the way it does things during the crisis continue in the post-COVID era. I want to congratulate Joanne De Laurentiis on her election as TTC Vice Chair. I look forward to working with her, just as I thank Commissioner Alan Heisey for his service as the Vice Chair of the TTC. Today, the TTC laid out in very clear terms the coming challenge of the city's restart and recovery. As more people go back to work and will have need to rely on transit again, we will have less leeway on our transit system to allow people to keep their distance from one another. I know this has been an issue that the Commission has been discussing today, following on discussions with Public Health and our Restart and Recovery Office. I've asked for clear information and direction to be provided to transit riders as quickly as possible. And this will be something that I'm sure you'll be hearing more about from the Commission, from the Medical Officer of Health, and from myself. Today, I'm pleased to announce that we're partnering with Toronto startup Ritual to launch Ritual One, which will support restaurants and food services here in our city and help to minimize the local impact of the COVID-19 pandemic on our local economy. This partnership with Ritual is part of our short-term economic support and recovery plan for Toronto. Ritual One provides restaurants and food services such as grocers, butchers, bakeries, coffee shops with an easy way to accept digital orders from their own website and social media accounts. Customers will be able to choose between pickup and delivery. Ritual One also offers on-site contactless digital ordering to continue to keep both employees and customers healthy and safe. Toronto businesses that sign up for Ritual One prior to June 1st will receive the service free for life and will not pay any commission or monthly subscription fees on Ritual One orders. And the offer is also available to existing restaurants in the Ritual marketplace. Standard credit card processing rates will still apply. Businesses will also be provided with a dedicated onboarding expert to help support them during the onboarding process. The shift to digital has been growing, as we all know, in recent years, but COVID-19 has accelerated this transition beyond what we possibly could have imagined. I want to thank Ritual, which is a Toronto success story in the tech ecosystem. I want to thank Ritual for developing Ritual One and partnering with us and with the restaurant industry and other retailers as we begin the work of rebuilding our economy in this critical time. It is through partnerships such as this, and I invite others to come forward with their partnership ideas for partnerships with us or with other elements of industry in Toronto. This is the way in which we can help our local businesses, especially the restaurant and food services sector, which has been especially hard hit, but this will help our overall economy to thrive again. Toronto businesses can sign up for Ritual One at ritual.co/partners, ritual.com/partners, that is, I'm sorry. Businesses enrolled in the city's Shop Here program, which we launched on Monday via the digital Main Street platform, will also be eligible for Ritual One and a lifetime exemption from commission and subscription fees. Toronto independent businesses and artists, and this is something that was perhaps underplayed when we announced the Shop Here program, that artists are also eligible to sign up for that to get the free online Shop Here store, which we will provide to them, assistance we'll provide in partnership with business and with the Schulich School of Business, and that can all be accessed at digitalmainstreet.ca/shop here. Through the city's digital Main Street platform, the Shop Here program, and now our partnership with Ritual One, more Toronto businesses than ever from every corner of the city will be able to have an online presence and connect with their customers and an even broader base of customers online. This is helping businesses to help protect jobs, which is going to be fundamental to our survival and, of course, to our recovery, the business community in our city. We also are anticipating, in the advent of the recovery and the post-COVID world, that restaurants and bars will need more space. And that is why I asked city staff to come back with a plan to expand patio space on appropriate sidewalks and streets. I think not only could this provide us with a more enjoyable summer, but, and that's especially after all we've been through, but I also believe that it could be a lifeline for some of our restaurants, and especially in light of the fact that they'll probably be required to have tables both inside and outside that are spaced further apart. And so I've asked our transportation services officials to come back to me with some possible locations where we could do this, and I expect we'll have some news on that fairly soon. Just as we did on King Street for restaurant patios when we rolled out the transit way, I think we can sweep away some of the red tape and get this done as a way of making the city even more friendly for everybody, but also for our hardworking friends in the restaurant business. Now, helping the restaurant business get open and get as much business as possible as soon as it is safe from a health perspective is one example of how the city government will help our economy to get up and running again. Safely and effectively helping our restaurant industry survive and reopen is an important role the city government can play. But while we, as a city government, are crucial to this restart, it is worth noting that the better our restaurant industry does, and we hope they will be doing better and employing more and more people and making more and more sales, the more money will end up in the provincial and federal coffers through sales taxes, income taxes, and corporate taxes. The city, in fact, gets none of this money. And that is why I'm pushing so hard right now to make sure the provincial and federal governments come forward with support for Toronto and municipalities right across Ontario and right across Canada. Strong cities give us strong economies, something we need now more than ever. I am very encouraged by Premier Ford's comments of today. He acknowledged that the TTC and municipalities are going to need the province's support and that the province is going to be there at the table. And I agree with Premier Ford. The province has to be at the table, but it also cannot do it alone. He said, and I quote, "We need the federal government," quote, unquote, at that table as well, and I agree with him. And I believe his invitation to them, to the federal government, will be important to getting them to the table. This is a good step forward in many different respects, and I look forward to all governments from across our country being at the table to have this important discussion about the economic engines called cities. I know all three governments have the same goals, which is to lead the strongest economic recovery in Canada's history. We want to help small businesses. We want to help families. We want to get vital infrastructure built in order to create jobs and move people and do other things that are important to cities having a good quality of life. We want to help the most vulnerable in our communities. We want to keep vital transit systems operating and, for that matter, expand them where needed. And the best way to do that right now is by helping cities. Finally, the Debenture Committee met today. I'm pleased to be the chair of that committee, and it approved a $200 million bond to invest in capital projects for the TTC, long-term care homes, solid waste, and Toronto Public Health. Ordinarily, a meeting of this kind might not be taken note of, except for the fact that in these very difficult times, and when the city is having some short-term operating difficulties and the economy is where it is, the expressions of interest in purchasing the city's debt were more than 2.5 times the $200 million in debt which was being offered to the marketplace. This is a positive indication about how investors feel about the City of Toronto and its prospects and its management, and they told us so. The city is moving ahead now with social bonds, a first for any government in Canada, and this follows the city being one of the first municipalities to offer green bonds. We expect to issue up to $100 million in social bonds this year. Investor demand, the way these work is that the investor demand to be able to invest in specifically funds that are going to go to these kinds of social investments I'll mention in a moment, leads to a lower interest cost for the city, and these investments, of course, then bring about positive change in our communities. Many of these same investors that were eager to invest in green bonds originally are now looking to make an impact by investing in the community and social services that are provided for by the social bonds. And it'll help in areas like social and affordable housing, affordable basic infrastructure like access to clean water, sewage and sanitation systems, transit, access to essential services like municipal long-term care, senior services and emergency shelters, and socioeconomic advancement and empowerment like public libraries and community hubs. So you can see We're working hard on a whole host of fronts here at the City Hall to help residents and businesses to get things done and to enjoy a robust recovery as we enter that phase. While the COVID-19 emergency is one of the greatest challenges our city has ever faced, I'm confident we will get through this because we're all working together. And importantly, all three governments are working together, but with a whole host of other partners to make sure that we continue to help those who need it now and get back on our feet. We're building partnerships with private companies, with nonprofits, with other governments to make sure that we have the strongest recovery possible. That has been our objective from the beginning. In addition to saving lives and keeping people healthy, that will continue to be the set of goals that we're working towards here at this table and elsewhere throughout the civic administration. And now it is time to call on our Medical Officer of Health, Dr. Eileen de Villa, to give her report for today.
Thank you, Mayor Tory, and good afternoon. Today, there are 169 new COVID-19 infections in Toronto. To date, 5,655 people have recovered, an increase of 206 since yesterday. More detailed data on the status of COVID-19 cases in our city is available on our website. By way of update, I wanted to share that I recently learned of the second COVID-19 death in a resident in the shelter system. Sadly, on May 11th, a man in his 70s who was a resident at Seton House died in hospital. Once again, on behalf of my team, I extend sincere condolences to the friends and family of this individual and to all others in our community who have lost loved ones to COVID-19. There has been a COVID-19 outbreak at Seton House since April 6th. An outbreak is declared when 2 or more people in a shelter test positive for the virus. All Seton House clients have been tested, and the 28 individuals who tested positive were moved off-site to appropriately isolate. The outbreak will be declared over after 14 days with no new cases in the setting. In response to the situation at Seton House, my team has worked with the city's Shelter Support and Housing Administration Division to ensure the following: enhanced infection prevention and control and screening and physical distancing measures are in place. Enhanced cleaning and disinfection measures are in place, and signage on hand washing and COVID-19 signs and symptoms are prominently displayed. While this outbreak has been ongoing for a number of weeks, my team has confirmed that all of the appropriate measures are being taken to protect the health of residents and staff at this facility. We continue to carefully monitor this situation, and my team is working hard with the staff at Seton House to end this outbreak. On another topic, I started to receive questions about our seasonal Lyme disease prevention work, which usually begins around this time of year. Lyme disease is caused by bacteria transmitted to humans through the bite of an infected black-legged tick. While the weather has certainly not felt like spring this week, we know that nice weather is just around the corner, and more people will soon be spending some time outdoors in our local parks. Similar to previous years, our communicable diseases team at Toronto Public Health will follow up on all reported human cases of confirmed Lyme disease. Additionally, we are continuing to recommend that residents use etick.ca, an electronic tick identification platform. When residents find a tick on a person, animal, or elsewhere in the environment, they can submit a photo to learn if the tick belongs to a species known to transmit Lyme disease within 48 hours. Please remember that the most effective way to prevent Lyme disease is to avoid tick bites when you go outside, especially in wooded areas. To protect against tick bites, you should wear long sleeves and tuck your pants into your socks or your boots. Use an insect repellent containing DEET or Icaridin following the manufacturer's instructions. Search your clothes and your body for ticks when coming in from outside. Carefully check your children and your pets for ticks as well, and take a shower to remove any ticks before they become attached. Finally, a friendly reminder that today is Takeout Day across Canada. Toronto is certainly known for its exceptional culinary diversity. During COVID-19, many local restaurants are offering their menus for takeout service. My family and I have always supported our city and neighborhood restaurants. Since COVID-19, my family has continued this tradition and has been ordering takeout or delivery from the many local restaurants in and around our neighborhood. Although we miss traveling across our city to sample the many food choices our city has to offer, this is one small way in which we are trying our best to support our community at this time. I encourage everyone to take part in Takeout Day to support our local businesses as you are able. In closing, please continue to practice physical distancing when you go outside, and please continue to take care of each other. I'll now turn it over to Chief Pegg for his remarks.
Thank you, Dr. Davila, and good afternoon. As you know, managing the supply and inventory of PPE during COVID-19 has been very challenging. We continue to deal with significant global supply chain issues in response to the extraordinary demand for PPE around the world. I'm very proud of the exceptional work that our team has done and continues to do in order to ensure that we have the supply of PPE that our frontline workers require. Our present PPE inventory levels, based upon our current consumption rates, which remain consistent this week, are as follows. We have a 15-day supply of N95 respirators, a 751-day supply of surgical masks, a 245-day supply of isolation gowns, and a 20-day supply of face shields. You will note that our supply of N95 respirators stands at 15 days. We have a number of PPE orders that have been placed, and we are awaiting delivery of those items. Should delivery be delayed such that we deplete our current inventory, we have contingency plans in place that include deploying our pandemic stockpile of N95 respirators. PPE is being monitored on a daily basis, and we will continue to proactively manage this ever-evolving situation. As a city, we continue to provide the essential and critical services that our residents both need and rely on each and every day in Toronto. Our EOC continues to operate 7 days per week, ensuring that both critical and essential services are being provided without interruption. The Strategic Command Team continues to convene on a daily basis, ensuring that clear strategic direction is being provided and that issues that arise are well coordinated and addressed without delay. Today is the 64th day of continuous EOC operations in Toronto. As additional retailers continue to open in our city, I'm pleased to advise that once again, we have not received any complaints relating to curbside pickup operations in Toronto. Our Curb TO team, led by our Transportation Services Division and in collaboration with our Emergency Operations Centre, are also hard at work to ensure safe and effective physical distancing on our streets. Staff continue to install various interventions, including curb lane pedestrian and temporary parking pickup zones. and have successfully implemented 49 installations to date, with over 200 additional requests currently under consideration. A couple of examples of successful curb TO interventions include the Yonge Street Mission at Parliament and Gerrard Street East was exploring options to provide better physical distancing for clients waiting to access the food bank. Staff worked with the mission and the local councillor to quickly accommodate with a curb lane closure on the north side of Gerrard Street East. Additionally, a Food Basics store at Lansdowne Avenue and DuPont Street was concerned about the potential for long lineups on a narrow sidewalk with a number of pieces of street furniture present. Staff implemented a solution for a north side curb lane closure, including the installation of 3 asphalt ramps to ensure continued accessibility. I thank each of our residents, business owners, and everyone in our city for continuing to respect these very important public health guidelines. As the weather gets nicer, I encourage everyone to stay the course to ensure we stop the spread of COVID-19. We are truly all in this together. As always, I remind everyone that toronto.ca/COVID-19 is the best source for up-to-date information on COVID-19 in our city. Thank you.
Thank you, Chief. Just for reporters on the line, staff joining us include Mary Ann Bedard from Shelter Support and Housing and Paul Raftis from Senior Services and Long-Term Care. First question is to Austin Delaney from CTV. Austin?
My question is to the Mayor. Mr. Mayor, have you been able to take advantage in terms of road construction of the lower number of vehicles on the roads during COVID-19?
Yes, we identified a number of projects, and there's a summary of some of those out today that we've accelerated to provide for longer hours or just to generally speed up the work. We have speeded up some of the tenders of projects on some of the major streets so that we can get those reconstructed or repaved while the traffic levels are down. And people sometimes wonder why we're doing these things. In a couple of the projects, one on Bathurst Street, another over by Richmond and Church downtown, we're replacing 143-year-old water mains. But the key here is we're now going to speed that work up. We're going to speed up the repaving work. We've identified a number of projects, and we're moving forward with those on an expedited timetable so that we can hopefully get much of that work done before the traffic restores to normal levels.
Thank you, Mr. Mayor.
Okay, thank you, Austin. Go now to Dave Ryder from the Toronto Star. Dave?
Hi, first question for Mary Ann Bedard. This is the second person from the homeless shelter system who has died. Can you just tell us, is this, I mean, it's only 2, some would say, although 2 too many, but it is 2 within a couple of days. Are you concerned that we'll see more infections and more deaths?
Thank you for the question. Yes, I totally agree, too many. You know, it's always been our plan for as long as possible to keep COVID-19 out of the shelter system because we were aware of how vulnerable the clients were. And we're working very hard to mitigate the harm that this virus does to this population. We are closely monitoring the situation. We stay in touch regularly with Toronto Public Health to make sure that the measures that we are undertaking in the shelter system are adequate. And we remain confident that our response is working well. This is, you know, 2 months into the response. We've moved over 2,500 people in the last few weeks. And although it is sad, the number of people who have succumbed to the virus is low.
Okay, thank you. And my follow-up question is for Mayor Tory. Mayor Tory, in the last couple of days, you've talked about, in different interviews on different stations, talked about wanting to expand patios, and you've also talked about wanting to get off-leash dog enclosures open, and you've also talked about golf courses, wanting to get them open. It feels like there's a reopening plan, but you're kind of releasing it by eyedropper. I'm just wondering if there's anything else you want to tell us that would be among the first things to reopen in Toronto, and when the city residents will see a full reopening plan for Toronto.
Well, in actual fact, for example, golf courses and marinas, I'm merely responding to the timetable the provincial government seems to be on, in that they announced 2 weeks ago that those things could begin to prepare to open, and I guessed, I think correctly based on what I hear, that they'll be announcing something in that regard tomorrow. With regard to patios, it was really just an opportunity while we were implementing the active TO program, which is going to set aside public space to make sure pedestrians and cyclists have adequate room to get around, and there's going to be a good solid start made on that in the next couple of days. I thought it was wise for us to add an examination of patios on public space, again, perhaps including streets and other areas, sidewalks, so that we could enjoy the summer more, especially after what we've been through, but also so that those businesses, in light of anticipated physical distancing requirements, could have a better chance to recoup some of the losses they've experienced in recent times. So we're really more responsive to the provincial framework than anything else because their order is so broad, and we will continue to bring forward things that we're doing as a city as we reach decisions and as we formulate the right kinds of concerns that put health first.
Okay, thank you. We'll go to Derek Dina-Rain from the CBC. Derek, go ahead.
Thanks, Brad. This first question is for Mayor Tory. Just in regards to the TTC, how much money do you need from the provincial and federal governments to keep the TTC operating? And are you concerned that what the Premier and Prime Minister were kind of non-committal today when asked if they would step in?
I'm very heartened by the fact that Premier Ford has acknowledged that it is going to require some provincial leadership and participation, and furthermore that he has done exactly what the GTA mayors asked him to do, which is to invite the federal government to participate in those discussions. And we're going to be making sure we have written down on a consolidated basis the ask that the Southern Ontario municipalities, and for that matter all Ontario and all national municipalities have. You can see from the TTC report today that the cost to the TTC just up to Labor Day as a result of the pandemic is $500 million. And that's only up to Labor Day, and we need to obviously cover off the period through to the end of the year as well. And so the ask is going to be substantial, but the return is that we can keep a transit system going that is vital to keeping people moving today, essential health workers and others, and be an integral part of the recovery going forward. We've got to have a transit system in a city this size, and so do other cities similarly need their transit system to be helped along, and we have a huge deficit as a result of the pandemic.
And just to follow up, and switching gears towards some of the conversation around patios, how will you determine which restaurants are eligible to expand their patios? And is there going to be some sort of process where owners can apply to the city to expand their patio?
Well, as a first step, what I've asked the city staff to come forward with is areas of the city that would be appropriate to take up a road space and sidewalk space. It's not the case you can do that everywhere. We've had some success, obviously, on King Street with the advent of the King Street pilot. We had a project a number of years ago on Yonge Street where we closed down some access to vehicular traffic to create more patio space. So the transportation services people will come back with some recommendations in the coming days. We'll take a look at that, and obviously I think some of that would have to go on to council, but I think this is something that would be good for our city to do for a whole bunch of reasons, including the well-being of our restaurant industry, which is so important to us in light of the physical distancing requirements they'll likely be required to meet in the post-COVID period.
Okay, thank you. We'll go to Christina Tenalia from CP24. Christina?
And everyone there today. My first question for you, Mayor Tory. I know you commented in your initial comments that you were frankly encouraged by what you heard from the Premier today about the TTC's $520 million shortfall by Labor Day weekend. But the Prime Minister also commented today, and he didn't give any kind of firm commitment. He only said more or less that this is, under provincial jurisdiction and municipal jurisdiction, and we're going to work with the provinces, including supporting them in their areas of jurisdiction in many cases, but he was vague. Wondering your reaction to his comments. Are you encouraged by it? Were you hoping for a little bit more clarity?
If you compare where we are today to where we were yesterday, we now have the two governments, in our case, the Government of Ontario and the Government of Canada, and I believe, by the way, Ontario's leadership in this regard will cause other provinces to say that they want to come to the table as well. you now have those two governments saying they're going to come to the table. I didn't expect anybody was going to spell out an amount. I'm not even sure they would have known before the TTC report that came out today exactly what would constitute the amount we need to have health for transit and other aspects of municipal finance. I am very encouraged by the fact both governments have said they'd participate in discussions with each other. A great part of what I've been trying to do on behalf of my colleagues over the last few days has been to talk to federal ministers, federal MPs, provincial people, and get them to the table together. So they're now going to be there, and the amounts will be discussed, and I trust that they will support us in the manner that we need to be supported, all of us as cities, in order to produce the kind of strong, robust recovery Canada needs from its cities.
Thank you so much, Mayor Tory. My next question is for Dr. Davila. Wondering if you can provide us with an update on the outbreaks at Jesse Ketchum and Sick Kids Hospital.
So, Christina, unfortunately, I don't have specific information on those right now. I believe Jesse Ketchum is, that outbreak has come under control and it is reopening very shortly. I believe it's tomorrow, if I've got it right. And with respect to Sick Kids, I'll have to connect back with you, check with my team. But I know that the folks at Toronto Public Health certainly have a very strong working relationship with the infection prevention and control teams at all hospitals in the City of Toronto, including the Hospital for Sick Children. I'll close the loop with you or have someone from the team connect with you after this.
Okay, thank you. We'll go to Matt Bingley now from Global News. Matt?
Hi, good afternoon. I'm just trying to get an update on how many individuals in the shelter system who are in hospital would be in the ICU. I see that listed there is 9 currently in hospital, but it does not break down who is in critical care. So I'm just wondering if someone can tell me that.
So, Matt, I'm afraid I do not have that information. I can refer to Marianne and see if she knows anything further in respect of the conditions of those 9.
Marianne?
Thank you for the question, Matt. Unfortunately, we are not, we don't get informed on the status of patients in hospital. That is private health information. So again, my apologies. All I'm able to confirm is that we are aware that there are 9 people currently in hospital.
So, Matt, if I can just speak a little further to that. This is a relatively small number of individuals. So we will be rather cautious, as I'm sure you can appreciate, around how much information will be shared, just given that, you know, when we're talking about a small number of individuals, the risk of privacy being breached increases. We certainly wish all those who are in hospital and are sick with COVID-19 well, and appreciate the interest that you may have and that others may have in ensuring that those individuals are recovering well. But I think you will find that we may be quite cautious for reasons of privacy and wanting to best protect the confidentiality of those individuals.
Okay, and to Mayor Tory, I know you say that you're encouraged by the message from the Premier and from the federal government today. I'm just wondering, how long can the city really sort of limp on without having an actual commitment? How does it affect your planning when it comes to trying to determine where you have to sort of shift resources when you don't know how much money could be coming in?
Well, I learned when I was running a big company that the longer you leave a situation that is very difficult in terms of being short of funds or falling short on your sales or whatever, the more difficult it becomes to make up for that. And so I've certainly registered with both governments the urgency of the situation, and I think they understand. They've both taken that on board. The problem that we had in front of us was more one of having the willingness of everybody to come to the table and without worrying for the moment about, jurisdiction under the Constitution and whatnot, just to say cities have a problem. The problem includes transit and other things. It could start to have a real impact on ability to deliver services, let alone the city's finances. And I say cities in the plural sense, right across the country and right across the province. And so now we've taken a first major step forward with the 2 biggest governments in the country, frankly, Ontario and the federal government, agreeing to sit down and talk about this. And I hope that will be replicated in other provinces. I think it will benefit all cities in Ontario and Canada. And now it means we can get down to talking turkey and getting some money to offset those problems, which will mean that it won't be as acute a problem, while it will still be a challenge for us probably for years to come.
Okay, thank you. The next question is to Stuart McGinn from 680 News. Stuart?
Thanks so much. My question is for Mayor John Tory. Mr. Mayor, just looking for your response. First off, we heard from Uber today. They introduced a new policy. They're making masks mandatory for all drivers, passengers, and couriers. And I guess sort of a two-part question for you. Just first off, your response and sort of reaction to that. But also, we've seen some grocery stores in Toronto going as far to say they're making masks mandatory on their own. The TTC union said the other day they want masks to be mandatory for passengers. Is there any consideration for the city to go this far and take that step, or is it still just the recommendation if you're close to anybody to wear a mask? What's your stance on that and the reaction to Uber's decision?
This has been an evolving issue, which I've said many times has been discussed virtually every day since the pandemic emergency began. And I think Uber has taken a step, as others have, some of these grocery stores you mentioned, on their own to do something that was meant to keep their own drivers and passengers safe. I think while the word will come ultimately from the medical officer of health and not from me, I will just say that I think we're headed in a direction, if people looked at the words that have been spoken already by her and by others, where it is going to be something that is recommended to people to wear a mask in many different kinds of circumstances, whether it be retail, transit, or in Uber cars, and that's the direction that we're headed in order to prevent the spread of this virus going forward as people return to work and return to other activities. And I'm sure there'll be more to be said about that in the coming days in a more definitive way.
Thank you.
Okay, Stuart, thank you. Final question to Mark McAllister from City News. Go ahead, Mark.
My question has been asked already. Thank you.
Okay, that concludes questions then and today's briefing. Thanks all for joining. We'll see you again tomorrow at 3:45.